Hey everyone, and welcome to the Week 4 laboratory, where this week we're going to be performing mock neural surgeries. And to do this, we're first going to need a subject. So we have our subject, Mr. Rat, here, and we're going to need our equipment. So the tools for today are going to be a Hamilton syringe enclosed in here. It's attached like so. Then the main equipment that we're going to need is this stereotaxic surgery equipment. And so this stereotaxic surgery equipment is set up so that we can hold our subject's head in place. And so to do this, the first components are the ear bars that are located on the side here. One for the left ear, one for the right ear. So we're going to take our subject, place the head into the stereotaxic surgery equipment, and then we're going to put one ear bar into the right ear and hold down the ear in place by screwing down the ear bar. And then we'll put one into the left ear and screw it in place. Make sure they're nice and tight. We want to make sure that the head's not wobbling at all. We want to make sure the head's in place, nice and secure. Obviously, you don't want to have any air when you're performing a surgery such as this. So once we have our head in place, that's good. You'll notice on the very top of the head, there are some lines drawn, and these are actually where the plates of the head fuse together as we develop. And they create some lines, and one of those lines where they fuse together, the anterior portion is known as bregma right here. And this is going to be the center of origin for our neural surgeries. So what we're going to want to do is take the stereotaxic equipment with our drill that's been set up in place. And we have three knobs. The one knob on the very top here is for depth. And so this way we can then go dorsal, ventral, superior, inferior with the knob on the top. The knob in the very front here is going to allow for anterior, posterior modifications. And then there's one last knob on the side of the stereotax here that's going to allow for medial lateral adjustments. So what we're going to want to do is place our drill so that's centered right on the midline and directly over this area known as bregma. So you can lower the drill all the way down to make sure that you're centered onto bregma. Once you're centered, you're going to want to have your coordinates written down somewhere so you know where you're going to move from here to hit your target. Our target for this surgery today is actually going to be the lateral hypothalamus. So the coordinates are going to be 3 millimeters posterior to bregma, 1.5 millimeters lateral to bregma, and then we're going to go to a depth of 7.5 millimeters ventral from the surface of the brain. So first, let's just do one side. How about the left hemisphere? So to do this right, we're going to move 3 millimeters posterior. We're going to use the knob in the very front here to move posterior 3 millimeters. You're going to want to take a look at where your center of origin is first, and then move 3 millimeters back from there. Okay, once you move 3 millimeters posterior, then we're going to move 1.5 millimeters lateral. And then very gently, we're going to move the stereotax down to a point where we get to the surface of the skull and then start to drill in. And you just want to get through the rind of the grapefruit here, or the skull of the brain if you're doing an actual surgery. Obviously, you wouldn't want to penetrate the brain because you would damage some areas. But once you've made your drilling, then you can move your drill back up using the stereotax. And then we're going to replace our drill now with our Hamilton syringe. So we're going to unscrew the drill. And then take our syringe that's been filled with drug, but in this case it's actually been filled with some with some food coloring dye so that we can actually see where our infusion site has been. We're going to go ahead and then attach our Hamilton syringe to the stereotaxic setup, like so. And then move your syringe in place so that you're penetrating exactly where you drilled. And now once you get to the surface of the brain, again, we're going to be entering at a depth of 7.5 millimeters. So make sure you check to see where you are on your dorsal ventral axis here, and then penetrate 7.5 millimeters into the brain, and then infuse your drug into the site. Okay, so we're going to let that infuse a little bit, and then we'll go ahead and cut open the brain to make sure that we hit our target. Okay, now that we've performed our surgery and infused our drug, let's go ahead and see how we did. So we're just going to go ahead and make some sections in the coronal plane. Go ahead and make some cuts. Get a little bit further back. We're a little bit too anterior right now. Let's move a little bit more posterior. And you can see actually the entire infusion track of the drug being infused into the brain, in this case aiming for the lateral hypothalamus. There we go, successful neurosurgery taking place.